Hello, a warm welcome to our lecture series, surgery lecture series by Dr. G.R. Patel. Welcome to all. I, Today's topic is very important topic for doctors as well as paramedical and nursing staff. It's very important. That is why I have taken up the lecture series. Myself, Dr. G.R. Patel, ex-professor of surgery. Seemingly, the intramuscular and intravenous injections are taken lightly as if it is a minor procedure. Believe me, it is extremely important, extremely very important. It can produce life-threatening complications if mistakes or slightest casual approach to the procedure is taken. So one must know the every nitty-gritty of the procedure, which a medical person, nursing staff, and people must know, involved in the medical business must know. Rules must be followed. Intramuscular and intravenous injections. All injections must be administered under strict aseptic and antiseptic precautions, as good as those taken for a major operations. Site for injection must be decided by past experience of the clinician. How to prepare the puncture site, anatomical basis for puncture site, intergluteal, interquadriceps, interdeltoid sites must be selected. The medico is hereby advised to refer the book G.R. Patel's Experiences in Clinical Surgery, first edition, December 2023, for exact location of the puncture site. All clinicians must remember the parenteral injection is an irreversible process. There is no place for any mistake whatsoever. The clinician must have a trained assistant so that strict aseptic and antiseptic precautions can be maintained while giving intramuscular or intravenous injections. No touch technique must be followed. As if we are doing it in a surgery, in a catheter procedure, in an intravenous cannulation, so and so. The treating clinician must confirm and reconfirm the injection to be given by himself personally. The single-use sterile process PVC syringe and needle are provided in a sterile transparent PVC pouch. The external surface of the syringe pouch is exposed to external environment and studded with dust particles. So when the syringe and needles are taken out of the out, special technique is used out of the pouch. A special technique to open up the sterile instrument and given to the sterile or disinfected hands of a nursing staff or doctor. It is not taken open by and taken out by one person because the external surface is unsterile. The single-use sterile process, PVC syringe and needle are provided in a sterile transparent PVC pouch. The external surface of the syringe pouch is exposed to external environment and studded with dust particles. So when the syringe and needles are taken out of the out of a pouch, special technique is used. The tip of the needle should not be allowed to touch the external surface of the ampule. The cutting edge of the ampule cutter must also be disinfected with spirit, that is 70% alcohol. Requirement for intramuscular or intravenous injections. One trained assistant. Two pairs of sterile gloves, usually number 7, is enough. Spirit gauze pieces. Adhesive tape to cover the pointer side. Rubber tube band for compression of the extremity. Syringe, needle 24, 23 gauze, 22 gauze, 24 gauze, whichever is required. Parts of the syringe and needle must be identified, like bearer, piston, nozzle, which is central or eccentric. Eccentric nozzle is very useful or very convenient for intravenous injection. Flanges, head of the needle, body of the needle, tip of the needle, which is bevel. An emergency resuscitation tray or toddy must be available because any injection can produce anaphylactic shock, and if we are not ready for combating the anaphylactic shock, we might lose the patient. After cutting open the ampule, the liquid inside the ampule is aspirated in the pre-sterile syringe. While doing so, the tip of the needle touches the bottom of the ampule. The needle becomes blunt. So this needle should not be used for giving injection. It should be replaced with a new sterile needle. Now the injection is ready. The air present in the needle and tip of the syringe must be removed by holding the syringe vertically and ejecting a drop of the drug prepared in the wire. See, the needle snugly fits the syringe. Intramuscular and intravenous injections we are talking about. Every clinician must know the correct methods of administering intramuscular, intravenous, intradermal, subdermal, sublingual, intracardiac methods of drug administration. If proper aseptic and antiseptic care is not followed, there can be complications like injection abscess, anaphylactic shock, gas gangrene, nerve paralysis, thromboembolism, air embolism, foreign body granuloma, etc. So one has to be absolutely careful and serious about the labels on the ampules and wires. The label should not completely encircle the wire or ampule. The size of the label should be such flavor of the content can be seen, and whether the powder has been dissolved or not can also be seen. The size of the needle can be 16 gauge, large bore needle, to 26 gauge, very small diameter. Special 36 needle is available. 36 gauge needle is available for insulin injection. Containers for parenteral injection. Single dose ampule. There can be single dose wire, multi dose wire. There can be bolus. The drug is dissolved in saline pint. Pint is given IV. Single dose ampule. This is usually provided as a pre-sterile glass ampule, as you can see in the photograph. In the upper part of the ampule, there is a groove through which the ampule is to be scratched and then broken. While scratching the glass ampule, very small microparticles of glass are produced which are likely to go inside and mix with the drug. So avoid the contamination. The ampule must be wiped again with the sterile hospice before breaking the ampule. The drug in the ampule is withdrawn. The pre-assembled disposable single-use PVC sheet. Here the vial contains the drug in the powder form, single dose vial we are talking about, which gets dissolved in the sterile water for injections, provided with the drug containing the wire. The wire is closed by a rubber cork with aluminum foil bag. The prepared drug is now withdrawn in the syringe and is ready for injections. Next, our assistant must Prepare the site for injection. Deltoid region or gluteal region, very commonly used. Clean the area with a gauze piece, soak in the spirit, 70% alcohol. Wait for 3 minutes. Spirit is bactericidal in 3 minutes for normal bacterial flora present on the skin. So no bacteria penetrate the skin along with the needle. Do not touch the tip or side of the needle even if the glove is on. So the clinician who is administering the injection must scrub himself and put on sterile clothes. It is absolutely mandatory. This is the photograph of 3 ml disposable syringe. This is written on the picture also 3 ml disposable syringe prepared and pre-sterile 3 ml syringe. These are the glass ampoules. You can see there is a groove on the neck of the ampoule, and you can see the label on the bottom. The label on the glass ampoule is, does not completely encircle the ampoule. Otherwise, you can't see the content or level of the content or state of the content, whether the powder has been dissolved or not. If the label is completely encircling, so that must be avoided by the pharmaceutical company. There is a groove on the cutting the ampoule near the groove for cutting the ampoule near the upper end. The label, the ampoule should not cover the entire circumference of the ampoule. These are the photographs of the ampoule and the wires and ampoule cutter. This is wire with aluminum foil pack provided in a sterile. Intravenous injections are given only after negative hypersensitivity dose, intradermal or subcutaneous. It is given in distal vein of the upper extremity. Avoid a joint line. In a patient with abdominal trauma, venipuncture of lower extremity must be avoided because blood might leak out of the abdominal veins and and unnecessarily the blood might be wasted. In a patient with abdominal trauma, many puncture of lower extremity must be avoided. The great saphenous vein should not be punctured as far as possible. It should be preserved for future use, that is for bypass graft or CABG. If IV infusion is required for more than 24 hours, the infusion set should be changed or switch over to IV catheterization. Thermophlebotitis is a very common complication of IV therapy. Thank you.